Tampa. It's been a few weeks since our last hurricane, two in a row, and we all suffered quite a bit. And I am seeing quite a few patients now who are suffering from a number of conditions that are turning out to be related to black mold, despite the fact that they've had a lot of work done on their homes and everywhere else to assist in removing that. And so we're working to correct a lot of these conditions. I want to talk to everyone that is not aware of how this could be impacting them, despite the fact that they're doing good work to resolve it. First of all, we live in Florida. It's hot, humid, damp, wet, all the conditions that are ripe for black mold, mold of any kind to proliferate and cause problems. So the big causes are obviously always humidity, poor ventilation, condensation, and then the big ones that have happened during this hurricane, water leaks and flooding. You can do as much work as you want in your house, but even homes without any damage can still suffer issues related to black mold, and this travels throughout the home. The spores can impact you, you breathe them in, other related problems, and you start to suffer health conditions that may seem unrelated, or because they're happening weeks or months down the line, you don't associate them with those types of problems. So what are some of the symptoms? Coughing, eye irritation, headaches, sinus congestion, skin irritation, unknown rash-related issues, throat irritation, shortness of breath, wheezing, those types of symptoms. Again, that can be due to a number of causes, but this is generally what you'll see with black mold. So because we're all in this together, because we've all had these unfortunate events happen and impact our homes and our living areas and everything else, we need to be proactive in resolving these so that we don't have to continue with these conditions down the line. What can we do to address these? We have lab work in here. I'm going to put these labs at the bottom of these posts or in the comments so that you can have access to them. You can get them done yourself, and you can determine if you have any issues with black mold that you need addressed. You can also come into the office and we can run through those tests in here directly so that we can pinpoint that right away. Additionally, we have protocols already set up for this. Been treating black mold for years. This isn't something new to Florida, and it's not a new condition that people deal with. So we already have things in place. I already have protocols in place to address this quite effectively. What are some of these things? Specifically, glutathione. We use an S-acetylated glutathione, which is better absorbed, makes it through the GI tract and all of the acids that generally impact other supplements so they don't make it where they need to go. Glutathione is your master antioxidant in the body. It is going to recycle other antioxidants, C, E, CoQ10, lipoic acid, ones you've heard of that you may be supplementing separately. Just do the big one and it'll trickle down to all the others. The glutathione is essential in resolving reactive oxygen species that's going to be impacted by the mold. These reactive oxygen species are created due to the inflammatory nature of mold. We won't get too deep into that, but know that that's what we're trying to do. We're trying to resolve the inflammation and then reduce or eliminate, obviously, the black mold in the system. There's also quercetin in our protocol. You probably heard about this during the COVID days. It is a potent antiviral, but it's also a very potent antibacterial and antifungal, specifically for what we're trying to utilize it for. If you've ever heard of mast cell syndrome, this is people who constantly have reactions to, or an anaphylactic reaction to things over and over again, whatever they're having problems with. And that touches on a bunch of other things we need to fix. But again, those mast cells need to be calmed down in order for you to eliminate and resolve your mold issue entirely, other issues as well. So it's a potent mast cell suppressor and antifungal. So that's why it's part of our protocol. Then there's also a charcoal binder. Again, there's debate on whether or not this works. In practice, I've seen this quite effective for many patients. So that's going to bind with mold and help pull that from the body. We need to help eliminate this from the system. And just resolving inflammation, it still has to go somewhere. We still need to remove the mold. We still need to get it out of the body. And then a very potent probiotic with specific strains tailored to balance the body so it's able to assist in resolve and dealing with the mold on their own. You may be taking something already. I tell people again, this needs to be very tailored. You need to be utilizing supplements that are actively going to resolve mold, not just broad spectrum anything that may or may not be assisting you with your health issues. And last but not least, resveratrol. You may have heard about this. It's another powerful antioxidant and detox agent. Put these all together, and I've seen great results with people dealing with mold issues in order to resolve these problems so they don't need to have them ongoing. This is something that you need to pay attention to, because you'll start chasing these symptoms and you'll wonder what's impacting you. Remember, this hurricane was not that long ago. These mold problems start to build on themselves because, again, things are missed. No matter how much work you've done, no matter how well you've taken care of your house, there's still the potential for mold somewhere, and then it just starts to grow and it causes health problems. And I don't want your family or anybody else to be dealing with these issues because it can be debilitating. So contact my office. Look for the links in either the comments and or the body of these videos. And remember that we have lab testing and protocols to assist with this. In good health.